very good morning to everyone. I am Abhishek Pal, session coordinator of this event, and wholeheartedly I am welcoming you all in this 6 days FDP program. I hope you all had a refreshing evening and ready for another enriching day of learning. As we begin the third day and the session 1 of this event, we have a topic that is both timely and deeply relevant, not only to our professional lives but also to our personal well-being. Really, it is very much needed nowadays, because the tool which we are carrying with us, that is our mind. Engineering has always been about solving complex problems and creating sustainable solutions for society. However, in today's rapidly evolving world, while we focus on building sustainable technologies, it is equally important that we build sustainable minds. Innovation flourishes only when our mental health is nurtured, our stress is managed effectively, and our overall well-being is given the importance it deserves. Keeping this in mind, our first technical session of day 3 is on the topic mental health and well-being in the era of sustainable engineering, challenges and solutions. To enlighten us on this important subject, we are privileged to have with us an eminent psychiatrist, academician and mental health expert. It is my immense pleasure to introduce our distinguished resource person, Dr. Manish Roy, an MBBS and MD in psychiatry, currently serving as consultant psychiatrist at the Mission Hospital, Durgapur, and also as the Associate Professor and Head of the Department of Psychiatry at Sri Ramakrishna Institute of Medical Sciences and Shonoka Hospital, Durgapur. Dr. Roy completed his MBBS from North Bengal Medical College and obtained his Doctor of Medicine in Psychiatry from Agartala Government Medical College under Tripura University. His postgraduate research focused on the association between subclinical thyroid dysfunction and first episode depression, reflecting his deep interest in evidence-based psychiatry research. He has undergone specialized clinical training at the prestigious National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore, in neurology, clinical psychology, child and adolescent psychiatry and addiction medicine, strengthening his expertise across diverse domains of mental health care. With more than 15 years of rich clinical, teaching and academic experience, Dr. Roy has been actively involved in psychiatric practice, undergraduate medical education, national conferences and research publications. His work includes studies on depression, medical education and mental health awareness. And he has received several academic accolades, including prizes at national and zonal conferences of Indian Psychiatric Society. Ladies and gentlemen, please join me in giving a warm round of applause as we welcome Dr. Manish Roy. To honor our distinguished guest, I now respectfully invite our respected principal, Professor Dr. Orijit Kumar Banerjee, to kindly felicitate Dr. Manish Roy with a bouquet and as a token of our heartfelt gratitude and appreciation.
Sir, আমি দেখছি করে দিচ্ছি সব রেডি আছে স্যার বলা আছে
Hope this session will be an interactive session, because so many people do have queries regarding mental health, how to keep this mental health and well-being. So please ask question so that it will be an interactive session.
Good morning, everybody. Good morning, the esteemed engineering faculty members over present over here. Most probably I am the only one who is the odd man out in this August gathering, right? So everybody is a technical person over here. I am the only one who has got almost zero to negligible even awareness and some kind of knowledge about this changing, evolving era of engineering, sustainability, and the technological advancements. But still, what we'll be talking today, what we'll be discussing today, is a core and very important aspect of our human evolution, survival, and well-being. It is not related to the technical knowledge per se, but I would also like to say it is all-pervasive, which affects all domains of your functioning, including your professional, academics, personal, social, interpersonal. All this has coming down to this topic of mental health and its well-being. So my today's topic will be mental health well-being in the era of sustainable engineering. So I won't be talking about this sustainable engineering per se, but I would rather like to emphasize in this discussion and this session about the sustaining of the specialist, sustenance of the technical person who are in this field, and I have endeavored and gradually progressing the field of engineering and technological advancements. So it is about the survival of the faculties, it is the survival of the researchers, it is the survival of the technological persons, technical experts. And while talking about survival, I am talking about one very important aspect of the whole survival thing is the mental health. So first, let us discuss about the health. What is health? So I like to make it a more interactive session, right? So it should not be boring and like an academic discussion now, because I would like to, in the next slides, I might be using some kind of technical terms, medical jargons, which might be a bit difficult for you who are gathered here for the discussion. So I'd like to be more interactive to the audience. So anybody has any idea what can be a health? It's your common perception. Anybody want to volunteer? Like what is health? Health? It's a common term. We have to use every day, every moment. You can tell it, please. Huh?
Health is what?
Health is a
Mental and physical condition.
mental health, very good, madam. Very good. I'd like to say I really appreciate your at least trying to enlighten this matter of health. Yes, madam has rightly pointed out. Health, according to WHO, World Health Organization, health is a complete. Please focus on the words. Complete physical, mental, and social well-being. So, complete physical, mental, and social well-being, not merely absence of a disease or infirmity. So I have got no disease does not mean I am healthy. And again come to the diagnosis, again come to the definition. It is described in 3 words: physical, mental, and social. For physical, there are multiple disciplinaries across the medical science, right? Be it gynecology, be it medicine, be it surgery, be it orthopedics, you name it. But for mental, unfortunately, we are the only one. But it gives an equal weightage while describing what is health. And social well-being also somehow incorporated and interrelated with this mental health. Because mental health has an important component of social well-being too. So, before going into the topic in detail, and I would like to say I'd like to make it more interactive and more of a discussion rather than a didactic lecture. Okay? So, before going to any topic, I would like to summon my 6 friends. Those are called W friends. What are the W's? What, when, how, why. So first we have to understand what. Then what will be setting the scene. I have just categorized, I have just formulated my topic and lecture on this primary focus core group. So what, why, how, and what are the signs, how to recognize and what to do again. So what is mental health conditions which is accounted around this in the growing age of rat race and deadlines and the corporate pressures and the academic pressures. So what is that? Why it is important? How we should look at it and what should be done and how we can prevent it further, right? So this is my schema of presentation today. So this is my 90 minutes roadmap. I have planned almost 90 minutes of topic, including a session for the question answering, so that it will be more interactive and more engaging for the audiences. So first, I have already mentioned why it is important by the WHO health definition. So again, why it is important? So numbers, as we know, is no hips don't lie, but again numbers don't lie. So these are the numbers, you can understand. So these are the 44% of the engineering faculty, almost engineers per se, are suffering from some kind of mental disorders. It can be ranging from anxiety, depression to the serious psychiatric mental disorders. So 44% of the engineers who are estimated in the many studies and surveys are suffering from some kind of mental health issues. So the number is 44%, almost half. And 64% of the faculties have work-related burnouts. I would like to go in further detailing of this topic. What is burnout, what is stress, how to prevent it. So 64% of the faculties are suffering from some kind of stress and burnout in their routine professional life. So we can understand the estimate and the propensity of this and the magnitude of this mental health situation, which is mostly not addressed, not acknowledged, and not been taken into the serious discussion, right? So I'd like to throw some light on this. So what are the unique pressures for engineering academia? And I believe it is almost common for all the faculties across the branches, not only engineering but medical, be it economics, be it other social sciences, be it anything. I believe these remain the same for all of these faculties who are into this academia, right? So the first one is publish or finish. We have I don't know about engineering faculties, but as a medical faculty, I am also a faculty in a medical college, we are a constant burden to publish certain thing, at least certain interval. So that not only for enriching our knowledge, but for also, you know it very well, for our promotions, for the requirements set by the NMC, National Medical Organization, American Medical Commission, and for you it might be AICTE. I don't know, pardon me because I have no such detailed knowledge about this, but I believe even the same for across the academia. So we are under constant pressure to publish something and something at a continuous interval. But what I want to talk about, it creates an immense pressure. So I am not talking about the blue collar corporate engineers today, right? Because we believe all of them were gathered here are the engineering faculties. So my topic and the focus will be on the faculty related stress and burnout and how to solve it. Second is the triple mandates. Teaching, we don't, again the same thing. As an academician and as a professor in a medical college or engineering college or be it any college, we are not only focusing on the student teachings. We also have to focus on teaching and administration. Before coming here, I having a discussion with the principal sir, I somehow could relate to him as he was telling that some AICTE visit was about to happen in 2 days, and how immense pressure came to the faculties to make everything into order. And for us, our medical professionals and faculty, it is even more pressureful because as I was telling that he was intimated 2 days back, right?
1 day back.
1 day back. And we were kept completely in dark. We have to guess. Whenever we find somebody coming, a group of assessors coming down to this area, every audience around this area get on the toes. So nobody knows where they are going to go. It is so discreet. It is so discreet, and it is very more pressureful. It is more stressful for a faculty who is working in this thing. And you know what is the burden of administrative jobs and this reading the papers and all these and keeping everything in order, everything. Finally, relentless tech pace. As you all know, the technology is advancing like anything, at least in the era of artificial intelligence and other mechanical, other machine learning and all. I should not be commenting on this, but at least we all know how it is progressing day by day and what is the speed of the progress, how fast they are progressing. So we have to catch up with that also.
না না ওটা দেওয়া যাবে না তো
And finally,
ওটা দেওয়া যাবে না
crowdfunding anxiety. Those who are in academics and in research works, we also have to fund our research work, and to get the grant, we have is another burden of pressure to our complete social and mental well-being. And finally, compliance burden. If we are not compliant with the visit, so the onus lies on the faculties. And also the administration gives an immense pressure on us why it was not compliant. And if as a medical college faculty, when we get the compliance certificate, it's like a nightmare. Because they are again coming after 3 months and we have to prepare again everything in right order to meet their compliance. So the compliance burden, but all of this burden, be it administrative work, be it teaching work, be it research work, be it clinics work, all of this coming, the center is you. So everything is revolving around you. Even the students will be, students' pressure, their academic endeavor, their academic excellence, all these topics, the centers around you. So this is the unique pressure which is dealt by all of the faculties who are in these professional courses, right? So, how this happens and how this chronic burden gives you a mental health issues. So, a quick summary. I like to quickly summarize this whole topic because this topic is too much medical in nature. But I would like to tell you in a basics, in a nutshell, how it works, because we all talk about stress and stress, but we don't know how it works, and even we try to understand, we always try to give it it's something like it's outside thing affecting me, but how it's affecting, these slides will show you. So if we're having a chronic stress, any stress, be it physical or even a surgical procedure, and chronic stress gives you the brain same type of stimulation and brain reacts in the same way. So feeling sad, intense pain, psychological or physical, arises, stimulates the same part of your brain which also arises, also stimulated when you have a fracture. So having a mental agony is not something which is malingering or made up thing. It is within your body and the pain is really real. It is not something which is beyond your body, beyond your mind, is something spiritual, nothing else. It is your body. So any stress first affect the hypothalamus. It also in turn stimulates the pituitary gland. I believe you all know about these terms, pituitary adrenal. This is a basic biology, which you've all learned in class 10. And this actually gives rise to this cortisol release. Excessive stress actually activates HPA axis, hypothalamo-pituitary adrenal axis, which in turn releases a hormone called cortisol, which is called stress hormone. And this hormone in turn again re-stimulates the hypothalamus, and this loop continues. So why this cortisol is so important? Because cortisol is a anti-insulin hormone. It works against the insulin. So do you understand? Can you explain what it can do to your body? It works against the insulin. So any idea what it can do? Yes. It will give diabetes. Cortisol also activates your sympathetic nervous system, in turn which increases your blood pressure. Cortisol actually reduces your immune response, which in turn makes you prone for infections. So chronic stress is not a physical, not a mental thing, also it's very much physical thing. It increases your sugar level, it gives you metabolic syndrome, and also gives you a same effect like diabetes by reducing your immunity. So this actually affects not only mentally, it is physical also. And now this is the physical thing, now I'm going to the mental thing. How it affects your mental functionings. And what are the core brain parts which are involved? First, prefrontal cortex, this part of your brain, which is mainly dedicated for the judgment, your analysis, your decision making, your executive functionings. So whenever there is excessive cortisol and under stimulation of the prefrontal cortex gives you what? Lack of attention, lack of motivation, poor judgment. And in turn, it will affect your ultimate academic and other productive efficiency and your potential, not realizing your full potential. So by reducing the activities in the prefrontal cortex, it actually gives you a fatigue, mental fog, some kind of less productivity, right? Second is amygdala. Amygdala is a part which is like your posterior brain and which acts as a fear sensor. So anything comes to your brain which brain senses is something to be dealt with in a very urgently and with an utter necessity, so it alarms the whole body. But in a chronic stressful situation, it is found that amygdala gets hypersensitive. The sensor is overwhelmed. So amygdala in turn what it does? It alarms the body when there is not an actual danger. It sometimes perceives some danger is coming and alarms the whole body, which gives you some kind of feeling of anxiety and your physical symptoms of anxiety. So amygdala is responsible for causing you, giving you overdrive and sense of unease, apprehension, what is going to happen, and it ultimately affects your bodily functions. And the hippocampus. Hippocampus is a part of brain which is mainly responsible for your memory functions, memory formation and memory storage. So, whenever it is found that in chronic stress, hippocampus is getting shortened, it is degenerated because of some laminar cells in the hippocampus get degenerated and it actually impairs your memory functions. So, the physical underpinning, the neurological underpinning of the stress and its ultimate results in your body. So, before going to again, now, what is stress? We are telling about stress and stress and stress. So, what do you think? What is stress? Anybody can volunteer. Stress, like?
Yeah, one situation.
Yes, the situation which is
Not desirable.
not desirable. Yes. But do you think stress is good or bad?
For some time it is good.
Very good. Very good. Stress is not all bad because stress is the integral part of your life. If you don't feel stress, your performance is going to deteriorate. Suppose you have an examination tomorrow, you are not taking any stress. You are in us. Still fail. And again, tomorrow is your examination, you are taking too much of stress. You are not, and your hippocampus get shut off. You could not perform the memory. Your body goes in alarm mode. You cannot focus. Again, the same thing. And the end result, your examination results is going to get affected. So, the stress which is optimum is called eustress. And what we are talking about this today is called distress. So, eustress is required actually for the optimal functioning of any individual being. But distress, we are talking about that. So what is the burnout? And next, when somebody goes into chronic stress, this is the most vulnerable period, because something which is called acute stress, something which is called chronic stress. Acute stress means something which is very acute in nature and goes in its own way. I can give you an example, right? Like somebody, you are going in a dark alley and some like hooligans comes to you with a dagger or a pistol by snatching your purse. It gives you acute stress because the situation is very acute and eventually it will subside. But what we are talking about is the chronic stress which cannot be, which is unavoidable, part of your life, and it's happening every day. And it's a building up, building up, building up. And ultimately gives rise to what? Burnout. The stress, first few days, few minutes, few years, few months, you will have an idea of the stress. More the stress you get, the more active you may become, the more you become not only active, you become more productive, and sometimes you get too confident that I have to do, you are always on the go. But it has a limit. Because though we might say our body can do wonder, yes, our mind can do wonder, but it has a limit too. It is not infinite. My body has a reserve. My mind has a reserve, my brain has a reserve, which is can't go beyond that. And sometimes you have mind of how this program, this will only use 10% of brain, it's completely bullshit. No. All the brains are active all the time. Part of the brain are dedicated for part of the functions, which collected together gives you the whole action and your thought, your perception, your mood, your emotion, your experience. So it is completely a hoax that you are only using 10% of your brain. So if you could have used 90%, what it can done now? Completely wrong. Hoax. We are using all the time, even when you sleep. 100% of brain is already active. But it is doing some other functions that time. It is not resting, it is not sleeping. One part of your brain is actually active and forming the memory. So, your brain, your body has a limit. And the limit is crossed, called burnout. The burnout term comes in here. So, the burnout may not be a clinical diagnosis, but it is very well accepted terms used in our corporate world, in our day-to-day functioning, and any environmental like any occupational environment. So, a chronic stress leads to burnout. So, 3 stages of burnout are there, 3 stages. First is the, as I already told, emotional exhaustion. If you have chronic stress, when you are stressed, you are on the go, you are on the toe, like I have to walk, I have to function, but sometimes you feel I can't do it anymore. It is now beyond my capacity. Gives you the emotional exhaustion. You feel fatigued every day. You feel you are meeting grand desires before you are even day starts. You don't feel like go for again another grant to achieve a grant, to achieve some kind of thing, and you feel very hopeless at that time. So it's called emotional exhaustion. Second phase is called cynicism. Cynicism means can't power now. I can't do it any further. It is beyond my capacity. So this gives you the hopelessness. And ultimately, as you all know, all of this combined together to give you the reduced professional efficiency. So the burnout is nothing but the manifestations of chronic, untreated, unregulated stress in your life. So what are the signs? Now I will come what to look for. And the charity begins at home. If you find any of your colleagues or your students or anybody having these signs, you should be a good Samaritan by advising them the proper guideline as were intended in this session, right? So, the first sign is the physical signs. What are the physical signs? Persistent fatigue. So, always you feel very fatigued, something like that. Then, disorganized or disturbed sleep. You are having difficulty falling asleep. You are waking up very frequently in the night, or you are waking earlier than it was intended. So these are the signs, physical. Second, digestive issues, very important. Very important thing, digestive issues. This is called gut-brain axis. When your brain is in stress, in overdrive mode, first it affects your gut. So that is truly speak of that gut feeling. Gut has a feeling. Gut has a feeling because it is connected to the brain, and whenever some tendencies or some kind of storms is going around your brain, it affects the gut functions, your gastric emptying and your bloating, acidity. So many a times, even a gastroenterologist friends actually encounters most of the patients related to the stress-related gastric issues as misdiagnosed as something like actual gastritis or something like that. So these should not be overlooked, digestive issues. So the physical symptoms are persistent fatigue, disturbed sleep, frequent headaches, and GI issues. Emotional. You find irritability, feeling of hopelessness, you find very angry most of the time, you are irritable most of the time, you cannot focus, you are getting a bit nervous, you also all your worries, and lack of enthusiasm. You are not getting motivation any further. Finally, the cognition, as I already mentioned, brain fog, forgetfulness. Cognition means your mental functionings, like your higher functionings, which includes cognition, means brain fog, forgetfulness, difficulty in drifting, and trouble in concentrating. And finally, the behavior. You will find yourself not willing to mix with the people as you wish to. You are not able to socialize. You are feeling mostly withdrawn. Procrastinations. You but actually it is not procrastination, actually it is lack of motivation. You are not you are not getting the drive to move on your functions. You just carry on your functions because you are again emotionally, physically and mentally exhausted. So procrastination many times is not laziness, maybe a sign of untreated burnout. So finally, one of the most dangerous things, which all of this can actually give even a more disastrous outcome. What is that? Substance abuse. You make it a drinking a regular habit to liven you up, to rekindle your motivation. But alas, doesn't work. It works for sometimes, it seems to work for sometimes, but actually in long run, it actually deteriorates the condition even further. Because I'm telling in actual biological terms. Alcohol actually reduces the volume of hippocampus again further. So hippocampus, as you can understand, prefrontal cortex, hippocampus and amygdala. So alcohol, apart from the liver biology, is known to everybody. It harms your liver, it harms your kidney, it's known. But you know, it is actually more harms to your brain than your body. So for some mood, you to elevate your mood, you start abusing these substances, and which gives you even more psychiatric complications. So these are the signs. So if your colleagues or any students is showing some of these symptoms, don't be judgmental. Try to understand the condition and, if possible, try to give them a helping hand. As you are already aware, I believe you are aware of this. What should you look for? So how this burnout spreads? So faculty burnout gives rise to teaching quality, mentorship, research output, and family and personal life. This is very important again. These three topics I believe we have discuss about this, like how they are affected, how they are affecting your day-to-day functionings. But this is again family and personal life, which is unfortunately strictly neglected in Indian scenario, because Indian work ethics are too much toxic, which is unlike to any Western countries. Because in Western countries, an American engineer has a right to switch off the official phone after the official duty hours. But in India, you are not only reprimanded, you are not only given this opportunity or this privilege. It's not privilege, they don't think it's privilege, but weekly, just switching off the phone after the duty hours is like a privilege, and which is most of us doesn't get. So, in Indian perspective, the toxic culture actually gives rise to more and more emotional drainage, emotional turmoil, and in turn gives rise to poor mental health conditions than your Western counterparts. So, this is called family and personal life get severely impaired. So, root cause. Yeah, as you already understand, what is the root cause? We'll discuss that. So now I will be talking about this, how to now this is my topic, end of the first half of the topic, which I believe to talk about what are the what is stress, what is burnout, how it works, how it affects your body, and how it affects your functionings. Now, before going to how to prevent it and how to cope with this, I'd like to take some questions from your audience so that I have a clear idea whether I understood or not. So, anybody have any questions? Because then I will go into this next part, how to prevent it and how to cope with it. Which is, though it is a topic, not a topic to discuss in a seminar like this, mostly it is individualized because the individual requirement might be different from the. So, but I would like to give a general idea. So, up to now, anybody has any queries? Then I can shift to the second part. Okay? So, now I have to see. First, now I have to sit here to make you demonstrate what to do. What is called this? How to cope with the stress. So this is called, sorry. To cope with the stress, there are certain techniques that we all our patients or clients to follow. First is called mindfulness therapy. And mindfulness, mostly we ask our clients or patients mostly to do two exercises. One of those, first is called relaxation technique. What is that? It's called Jacobson Progressive Muscle Relaxation Technique, JCPMR. So what to do to reduce the chronic stress and chronic burnout? Like cope with the stress. This is a technique where you have to sit in a chair. Okay? And after that, try to concentrate every part muscle group of your body, like scalp muscle, like your chin muscles, mandibular muscle, chest muscle, hand, everything. Start from here to here. Right? First tighten the muscles. This muscle, then this muscle, then this muscle, then this muscle, this. And like that, from head to toe, you have to progress it. The first, the tightening of the muscle, after then goes the relaxation of the cell. Tightening, relaxation. First head to toe, then toe to head. So this is a very unique and very interesting exercise which can be adapted in your day-to-day life so that you can have some coping style in your hand so you can cope with the stress, ongoing stress and burnout. So this is called progressive muscle relaxation. Start from the head, muscle tightening, relaxation, tightening, relaxation, tightening, relaxation, tightening, relaxation, tightening, relaxation, like that. And one muscle tight, relaxation. So, and this has to be done at least 5 to 10 minutes every day. Second is called the deep breathing exercise, the relaxation techniques. How this should be done? First, you have to sit in a chair, preferably in a quiet and undisturbed room. If not undisturbed, it will be okay, but it is preferred. So, in this room, you have to sit in a comfortable couch, comfortable chair, and try to relax all the muscles of the body, like something. Like, you should not feel any pressure from any part of the body, right? Then, on the count of 1, 2, 3, 4, take a deep inspiration. Hold for 2, 5, 6. Again, 7, 8, 9, 10. Expiration. Inspiration, hold, expiration. The whole process should be done in 12 seconds. 4, 2, 6. Total 12 seconds are cycle of inspiration and expiration with holding the breathing. So this gives you a full mind relaxation. And while doing this process, you have to focus on your expiration and inspiration, like respiratory process, and focus everything towards that as if you are watching yourself from outside. And no other thoughts should come to your mind by that time. So this is how it works. It is called deep breathing exercise or relaxation technique. Like 4, 2, 6. Inspiration, hold, expiration. And all the time your mind should be blank and should be focusing on your respiratory process. And this ideally should be done 10 minutes, one at a time, 3 times a day, like total 30 minutes. But it has no side effects, you can do as much as you can. And even if you are waiting for certain call, some meeting, somebody is about to come, you are having certain time in your hand, you can perform it. Anywhere, in this. It is actually, it will give you like a relaxing your body and mind, because as I have already telling you repeatedly, your body and mind is not inseparable. They are connected. They are one. They are not an individual identity. And your mind is your body. Mind is like some kind of misnomer. Mind, what in sense, in traditional sense, what we understand is not what we learn in the modern biological perspective, modern medical perspective. Mind is nothing but the functions of your brain, neurons. And the brain has got inputs from multiple parts of your body. And brain also gives effects on multiple. So this part should be the first one is mindfulness, which can be done at your home and by your own self. And second one is though should be assisted by some professionals. What we call the professionals, they are called psychotherapists, clinical psychologists. Though it should be assisted by a psychologist, it is called CBT reframing. CBT means cognitive behavioral therapy. So, how to do it? So, we call it writing it down in a simple words. So, whatever, some kind of worries, some kind of thoughts coming in your mind and it disturbing you every day, or some chain of events, chain of events and worries coming to your mind, first we ask you to write it down what are actual problems right now. What are the problems I have to solve? And prioritize it, write it down. It solves half of your problem, believe me. Do it, you will get the result. Whenever you write it down, it will give a clear idea what are the challenges in front of me and what I should do. And unless you write it down, these multiple thoughts just jumble up together and come into your mind and disturb you. So it is a kind of CBT technique, but in a detailed CBT, which is called cognitive behavioral therapy, is a session-wise done. It is done by the professionals, those who just call paramedical staffs, who are working with us called psychotherapists or psychologists. Those who are doctors, but who they help us in overall well-being of the patient and the recovery of the patient in both pharmacology like by us and some other supportive measurements. But for you, which can be done by its own by writing a diary, thought diaries, and it will help you reducing your anxiety, reducing your stress, and gives you clear idea of what I am lacking, what I should do. Write it down. Third, sleep hygiene, very, very important. Sleep hygiene, very, very important to reduce your day-to-day sleep, because it is found that a mere 1 hour sleep time deprivation, 1 hour, increases the heart attack rate by 10%. 10 to 12%, sorry, 15 to 12% in a study, well-known study in America, because in UK, there is in winter times, they usually shorten the day by 1 hour. And that eventually gives you a lack of sleep of 1 hour. And is found significantly higher chance of heart attack during that phase of time in winter. So, sleep is it should not be just not a part of your life, it is a very essential part of your life, because sleep affects multiple parts of your body and gets inputs from multiple parts of your body. So, sleep hygiene, how it's done? Sleep hygiene means it has to be a routine one. You have to have a proper sleep, place of sleep. You have to have a proper time of sleep. I don't want you to sleep early and rise early. No, there is no such dictum. But it has been found that you have to have at least 2 hours of sleep by the time 9 p.m. to 2 a.m. at night. Total 6 to 8 hours is enough for your body and mind, but at least around that, among the total 6 hours or 8 hours, 2 hours ideally should be within 9 p.m. to 2 a.m. So try to sleep within 2 p.m. 2 a.m. sorry. Don't overdo it. And try to make it a routine that every day you sleep at every day you sleep at the same time. And don't use your bed for any other purpose apart from sleep. Make it a habit. Believe me, you'll get a benefit from that. So your bed is for sleeping. Every other work can be done anywhere in the room. Like while doing your official job, desk, table, chair, you are having your food, dining table, or any part of your body. You are having or watching your TV, sofa, couch. But sleep, the bed should be exclusively for sleep only. So make it a habit. And before sleeping, better to have a warm shower, like a warm shower, that will just relaxes your muscle and also dilates your blood vessels. That ultimately gives you a feel-good factor. And exercise is also very, very important. Again, it has a biological basis, because exercise, whenever you physically exercise something, it gives you a release of a hormone called endorphin. Endorphin is a naturally occurring mood elevating property, and it causes you the dopamine surge. Dopamine is a reward molecule. So what is dopamine? Whenever we find it joyful, we find it rewarding, we find it it is finding very interesting to work, interesting to perform. Believe me, all these activities actually gives you the dopamine surge so that you get addicted, so that you feel like doing this work again and again. So before sleep, exercise, not exercise, before sleep, all the other issues, and try to avoid from this caffeine, like caffeine and alcohol and other things. Don't use them before sleep, and try to cut down or stop alcohol if you can. And coffee should not be taken at least 2 hours before sleep. Coffee and tea. So this will impair your sleep hygiene. So the sleep hygiene should be maintained properly. So sleep is an integral and very important part of your social, mental and physical well-being. So try to reconnect with the purpose.
Sir, can you throw some light on dopamine?
Dopamine is a hormone which is a neurotransmitter present in your brain, which has got multiple actions, both centrally and peripherally. Dopamine is mainly responsible for causing you the feel-good, gives you the feel-good effect.
In some of the cases, we have learned that it is bad for, say, some
Yes, even if you
scrolling dopamine independent.
Yes, that is called dopamine surge. And dopamine surge also, whatever substance you use to get high gives you an absolute dopamine surge. Actually, NMD ecstasy is a dopaminergic drug, serotonergic drug. So everything in moderation is good. Surge is not good. Whatever what they do, what they does is called addictive dopamine. Even alcohol causes you dopamine surge. Even cannabis gives you dopamine surge. Even drugs gives you dopamine surge. So drugs are not good. So it gives you overdriven. You have to understand in medical science there is something which is called balance. But we also use dopaminergic drug to increase the mood level, increase the attention span. So what in moderation gives you a good attention, in high dose gives you, make you insane, make you addict. So if we in a controlled way increases your dopamine level to improve your mood, improve your attention, improve your concentration, and gives you a feel good factor, feel good effect, so that you can keep on doing the good thing for your life.
Is there any natural way to improve
Exercise. Exercise is a very good factor, and there are certain food which can give you. And I should not, should I tell everybody's anatomy here, is a good sex. A good intercourse is a very good for increase of the body. We are talking in the public forum like that, but it is, should not be hush hush about this. A good physical health includes your good sexual life. So good awareness is not about performance. It is you should be enjoying the act. It actually helps you in mental peace and gives you dopamine surge. So sleep, exercise, good sexual health, all of this very intricate crucial for your dopamine. And certain food also gives you dopamine surge. Like there are certain, and any food which you enjoy, actually, believe me, it gives you dopamine surge. So dopamine is everywhere, but uncontrolled level, unmatched level gives where all problem starts. So now you have to find the purpose of your life. So you have to understand you want the purpose. You have your own community, you have your own autonomy, you have your own impact of this functioning. So
is it okay to do exercises after sunset? Is it okay to do exercises after sunset?
Definitely, it is not an issue. But don't do it just before sleep. Don't do it. Because just before sleep it gives you excited. Yes, excited. Is the endorphin. But before sunset, just 2 hours before sleep should not be done. Like the same thing, caffeine should not be taken before 2 hours of sleep. And before that, it can be done any day. It is not an issue.
I heard that there is a ratio of endorphin and cortisol ratio is there.
Cortisol is something different. Cortisol, endorphin, all are naturally occurring hormones. Cortisol is completely different. I have not attended this first one, right? I display the cortisol. Cortisol is a stress hormone. Dopamine is a high hormone. They are, yes, definitely. They are in balance. Check and balances. Checks and balances are everything in human body. There is no such absolutistic term that this is good, this is bad. No, there is no. Anybody tells that this is good, this is bad, try to reflect from them. Everything is required. As you all told, this maida is bad. No, this is required. Carbohydrate is bad. Carbs is required. Protein is bad. No, protein is also required. All is bad. Fat is bad. No, fat is required. Unless you take fat, your brain neuronal myelin will not develop. You will have demyelination. You will have brain degenerations. So everything is good, everything is bad. The main is checks and balances. What is important to understand the moderation, the balance. Everything, like when you talk about a disease, we never talk about the absolute term. Your blood pressure should be 120 by 80. Before that, after that, no. We give you a range. Be in this range, okay, you can manage. So your body is a very resilient organ, very resilient, and it functions as an unison. It functions as an interdependent organism. Our organs are not separately acts. They act together, they act in unison, they act in collaboration. And they take inputs from any other person, even the most, apparently the most not very useful part of the body has certain use in some other part of the body which is you have not understood or you have not even thought of. Like liver has their own biological clock, which in turn affects the stroke. So who can imagine the liver has an effect on the stroke? So it has because if you take junk food before bedtime, liver does not process it well because the liver enzymes, the enzyme in our body does not have a consistent values. It goes ups and downs as the sunlight comes and fades. So even the sunlight, the environment is connected to your body. It has an input. So we are not only a united organism, we are not only a resilient organism, we are also connected organism with the environment. We might have detached ourselves from the environment, but environment is integrated within us. So environmental change actually adversely affects your physical and mental health. So, any question? Anything? Any doubts? So, what are the solutions apart from this coping style, your hygiene, your exercise, and also I forgot to tell you about this, I have not mentioned in this slide, the food, as I am talking about the food. You have to reduce the refined carbs as much as you can. Like sugar, even jaggery. Don't think jaggery is superior than sugar. Jaggery and sugar is the same thing with a color change. Changing the color is what is more processed. Same thing. It is a marketing gimmick, nothing else. Brown sugar, brown rice, brown atta, all are marketing gimmicks, having same calories, values, same. And if there are certain differences in the composition, this is insignificant. Not really important for our bodily functions. Like 2% more fibers does not have any effect on your body. It's like as a word, number doesn't lie, but we use the numbers to lie more often. Because numbers sometimes feels overwhelming, right? 10% more fibers. Your body requires, suppose 2000 milligram fibers, it gives you 2 milligram more. How does your body? So these are marketing gimmicks, marketing experts who are specialized in this job, how to manipulate the human mind. Say, even the marketing, even the corporates actually manipulates your mental health, your mind. So we have found that all these junks and the sweet things mostly kept in the down bracket. Do you know why? In a shopping, have you ever find a shopping mall? And have you found that they always gives you two entrance and exit? They don't allow you to exit from the same entrance. Why? So they make it sure that you have to visit everything, every corner of the shopping mall to get at least exited, so that you can buy more than you intended. And this, again, buying gives you a dopamine surge. So they also, without knowing, they all manipulate your hormonal functions. What are we talking about? Your dopamine, your endorphin, all are integral not for the biology, not for doctors. Even it is more important for the marketing specialists. So you have found that the reds, the colored things, which is actually not good for a refined sugar, full of refined sugar, kept mostly in the down brackets, like lower brackets, right? Lower brackets. Because they attract the kids and this is their reach. Kids has the reach. So it allures the kid. And when kid asks you something, hardly will be able to defy them. So you have to buy them. So this is how they tricks your brain. So this is suppose I'm going like distracted from the topic, but we have to have a good food, choice of food. First, for good mental health, cut down the refined carbs and sugar as much as you can.
Sir,
Yes.
in Horlicks light,
Bullshit. Throw it out.
yes, no
Throw it out.
sugar, zero sugar,
These all are marketing works. Taller, stronger. These are taller. Have you heard?
zero sugar, I am asking. Zero sugar in some food is written zero sugar.
Sugar-free is something different. So artificial sweetener is something different. Artificial sweetener is called something to excite the taste bud to give the sense of sugar, but it doesn't digest it in your body. This is actually good, not bad. You can use it. But zero sugar is not written. Most of it is written zero added sugar. Added sugar. But they don't add sugar, they add sucrose, they add sucralose, there are other factors. This is something which is very technical now. It makes you taller, stronger, sharper. Have you ever asked them how much taller and how I should get it? And since when I should notice the change? No, it's just like that. Because mere number, as I told you, mere number sometimes tricks your brain. Sometimes mere number doesn't. Like, suppose you have found that you are having a 500 rupees, suppose a pen, 500 rupees. So, you have found that a shop from 10 kilometers, giving the same pen with a journey, to take the journey, you have to suppose get 5 rupees away, journey fees of the how much per moment. And they are giving the same pen for 100 rupees. Most of you will grab that by going to that shop. 10 kilometers away. Most of them, I don't know, I give you an example. Suppose the same thing now, you are having going for buying an iPhone. It is charging you 50,000. Same shop. And another shop 10 kilometers. Same. They are also charging you 49,600 rupees. The 400 rupees remain the same. But hardly you find the people that they are just rushing to the second shop. Because we always know that sheer numbers is not which tricks our brain. Sometimes numbers tricks our brain, but sometimes the ratio tricks our brain. When we buy a high volume thing, we make it a ratio thing. So 59,000, 49,600 and 50,000 does not make any difference to us. But 500 rupees, 100 rupees gives a huge difference. So again, now your brain is very complex thing. It timely, in a separate time, it separately works. So the food, what I'm digressing my topic frequently. The food, and you should be increase your protein intake as much as you can. Contrary to the popular belief, contrary to what the doctors might advise you, take the protein as much as you can unless you have enough fibers to digest it. So take the fibers means take any kind of fruits, take like green leafy vegetables. They are very good at fiber source, but increase your protein intake. Don't increase the carbs. Especially the refined sugars, jaggeries should be avoided at any cost as much as you can. Oil, any oil is good. Don't think that this oil is good, better than this oil. Every oil is almost the same thing. And try to avoid those oil who get solidified at the room temperature. This is a rule of thumb. Now, palm oil never gets solidified at the room temperature. Coconut oil. Coconut. Palm oil is not bad per se. Palm oil is bad for the environment, not for your body. We are discouraging palm oil production because it destroys the Amazon rainforest. It's not harming your body, it is the same oil. Like your canola oil, your sesame oil. You must have the same food. Your calorific value, your nutritional value remains the same.
Olive oil?
Best oil. But olive oil is not good for your Indian cooking style. Because it has a lower heating point, lower boiling point. And we Indians tend to cook our food in a high heat, high olive oil. For Indian cookeries, best is the ghee. But it's expensive one, so beat any oil. The any oil will do, but oil in moderation, oil should not be avoided. Oil should be included in your diet. It is good. Everything is good unless it solidifies in room temperature. So, coconut oil is the only thing that is available in the market, but we Bengalis does not use it in regular practice. It is mostly found in the southern part of India. So,
Brown rice and white rice are same calorie?
same calorie value, same glycemic index, same everything, only color is different to allure. To give you a sense of elitism, to give you a sense of our elite, and buying this more healthier food. It's just a mental, again, manipulating our mind. To give you a sense of healthy living. And this gives you a good feeling, and unless if it gives you a good feeling, it's good for you. But it is not good for your pocket. So, brown rice, brown bread, brown thing, brown sugar, and brown sugar is bad because it is also not bad, and not about bad brown sugar. One brown sugar should be also be very aware of brown sugar drugs, should be available at any cost, and not about bad brown sugar. But this colored brown sugar is as good as your white sugar, as bad as your white sugar. So these are the good habits that should be following. Now, what the institution should do?
Yes, Durgapur is good
That was a good piece.
compared to which?
Yes, because it has a high fiber content. Compared to wheat, Durgapur is good. Because it has high fiber content and fiber is good for your gut health. Fiber is not good for your fiber is good for your morning routine. Pesava. But it is also is good for, it is not very vitamin rich or vitamin something like that. But it is good for your gut health, which is very important nowadays. As we are all talking about the gut brain axis. As brain affects the gut, even gut affects the brain. So having good gut health, you have to include fibrous food and fibers from any source. Try to avoid the sugar. Sorry. So what an institution should do? First, we are talking about what can we do in the individual level. But this is how we expect an institution to do for its employees. First, reduce the risk factors. What is anybody from the management? Anybody? So, what we have redesigned is the first thing, because we have to check for the available resources, available faculties, and the workload should be divided equally, so nobody get a sense of like discriminated or getting overburdened, right? So it should not proper SOP while distributing the work and while giving institution core values. So workload redesigns, futuristic and transparent institutional SOPs. It should be like transparent institutional policy should be a core of our employees' overall mental health. Because nobody should find discriminated, nobody feels find herself or himself dejected by the management. Because you should have a transparent policy. So this is how an institution can do it at institutional level. Third, transparent workload distribution across the faculties and protected and non-negotiable research time. This is also should be done by the institution, but it should be realistic. Any research work should have a time-bound activity, but institutional belief should have a realistic, set the realistic goal point, realistic end point, from by when we can end our research. And also, this also gives you or protective from procrastination. As I already told you, procrastination is not equal to laziness, but sometimes it's a sense of the outcome of the chronic stress or the burnout. And promote the positive culture. And this is for the colleagues together. What we encounter in any of these institutions and any management organization, it is called organization politics. Somebody has to backstab somebody, somebody has to overpower somebody, something like that. So there should be support, the institute support, the peer support network. So peers should help each other. Peer means the students. And even we incorporate the the teachers and the students together. And even the question arises, or sometimes the situation arises on the students' part, even the teachers can have collaboration to solve the issues. So nobody should like reject somebody, nobody should like sell somebody and be in a higher ground, but at least try to help each other. So the proper peer support network. Leadership accountability is a very important, which is hardly missing in our today's politics, I believe. So this accountability. But we expect this from the institution, and recognition and appreciation system again. যাতে করে বোঝার আবার তেল মেরে বেরিয়ে গেল, ওকে বসার সঙ্গে সম্পর্ক রাখলে বেরিয়ে গেল। So again, SOP should be there, a transparent policy for recognition and appreciation system. So one who does the work should be appreciated. One who does no work should be not punished, I should say, like reprimanded and given the next job, but somebody should not be getting it undue by some other means. So this is the part of the institution which can be implemented, not very difficult to implement if you have a goodwill. The goodwill is the only thing which deters somebody from implementing this part of the institutional values and institutional system of operations. So this is the end of the topic. I believe I have tried my level best to give it a concise, crisp and overall understanding of the how stress, burnout in the environmental settings works, how it should be dealt, and what the institutional policy should be come up with. So now I like to open the institution for the question and answer. Everybody has anything? So now I will
It's a open session for the participants. I think so many questions are coming in your mind, but maybe you are hesitating to ask, but you are welcome to ask.
Sir, you are telling about some steps to reduce the stress. Sir, you personally follow those steps when you are getting...
No, it's for doctor. We are not social reformer. We are not social reformer. We are professionals. I always ask the patient, do whatever I advise. Don't follow my life. My life is not ideal. I have not somebody to follow. My advice is to follow my advice. Because my advice is scientifically backed and for your best, good for your own future. But I might not follow some. But if you can at least don't follow it, follow rigorously, but try to follow at least some of this, definitely will go to help. I know that follow everything in total is almost impossible for everybody present over here.
How to overcome emotional exhaustion?
Emotional exhaustion, first we always two things, peer support. But the peer should be reasonable and confidential and could be whom we can trust. Trustworthy peer support system to share with them. Then comes the family time, share with the family if they are sensible enough. And if nothing works, then we are there. So these are the first step mechanism, first step training. But if everything after every intervention, if you think that things are going beyond your control, there are professional helps, yes. Be it psychologists or be it psychiatrists like us, who are there to support you in biological, medical way.
Once you start taking pressure medicine, so you have to continue like that.
Yes.
Don't stop.
No, you have to understand it is not that. As started the pressure medicine, that is the reason I have to take it, not like that. The hypertension by sport with the pathophysiology and the course of the illness is a chronic one. It's like same thing saying, as my mother used to feed me water in the childhood, in my infancy, I have to take my water till now. Now you are laughing, why? If the mother cannot give them water, you will not. It is required. It is not optional, it is required. The water is required. Last time pressure medicine is required. It is not that it is addicted. You are addicted to it. You are required. Your body does not function well unless you take the medicine. And this deficiency will not be covered by your body by its own. No. Because pressure, we have a well-established pathophysiological logic and pathophysiological underpinning how the disease works, how the disease emerges. And the targeted therapy treatment target that abnormal physiological process which is called pathological process. So if the pathological process emerges already in your body, hardly you will find it go by its own. No. But apart from that, you have to follow certain, as I told you, lifestyle modification, exercise, salt reduction, food habit changes. These are help. But this does not supplement or complement your requirement for the medicine.
Sir, recently a nutritionist prescribed me to replace white rice would be the solution, ideal solution for that?
Both of them, as I told you. I don't want to comment on anybody's prescription or anybody's advice. I believe that the nutritionist is already overdriven by this market-driven hoax. He has no actual knowledge. Because having actual, and it is very fancy to tell about, because sometimes the patients or the clients wants to hear this kind of fancy things from their. Because whenever I ask my patients or the patients, suppose for the teenage patients, they take fish, take chicken as much as you can, the parents get offended on me. What are you advising? We ask them not to take this. Why ask them? So they don't take it very, because they reinforce the already resided values within you. The societal beliefs within you, which is instilled in your body now, is bad. It has been instilled in you. So you are percolating the same information to your other practice, to your examination, but which is not scientifically backed.
The non-veg is giving more toxin.
No, not at all. It's got more health benefits. If you are completely vegetarian diet, you are inevitably going to lack vitamin B12, which has only source for non-vegetarian source. And for them only they should not be a problem, I believe, because for us, it is very interesting. For us, non-veg is the rule, veg is exception. Why? We call Amishashi, Niramishashi. So Amish is the positive word. Niramish is the negative word. Allah vegetarian, non-vegetarian. So for them it is completely different. So the way around, we should not be going by this like propaganda. We should not. Because stick to your, we have a very good dietary habit as a Bengalis. So we actually inherit from our forefathers a very good dietary habit. Don't just skip it for some gurus have told you. No, should not.
Second, that has to be replaced by roti, chapati.
Not like that. Both have same caloric. I already told you. The rice, the wheats are the same. Depends on how much you are taking it. Problem with the rice is that as we tends to take rice more in amount than roti. So that makes a difference. But if you become a North Indian, you take 10 rotis, it will give the same effect. So for a healthy life, we call, if you take rice, 200 grams, it equivals 1 cup of rice is equivalent to handmade rotis. 1 cup of rice is equal to 2 rotis. So make it like that. So no, nothing is better than other. One is better than other. Both are same. Your brown rice, brown sugar, all are same. If you want to have some British vibe in your kitchen, you go for it. Some like you have to show your peers that I am on healthy living, because being healthy living is a fashionable thing. You can go for it. It is not harming your body, not the benefits that you get.
Sir, can chronic stress sometimes lead to insomnia?
Definitely it is. Already I have talked about the topic. It will lead to insomnia.
Sometimes it happens that something is running in our mind.
I told you, join the program late, right?
No, sir.
I told you, read in the diary, whenever coming to your mind, write it down, it will reduce the stress, after reducing stress. All the answers are yes.
No, sir. Sometimes it happens that we have gone to sleep, say at 11 p.m. and something is running in our mind, and we are unable to sleep. Then what to do at that time?
For that time, if possible, take a diary and write in other thoughts. What on your mind? If it's not helping you, try to go for the relaxation technique that I have told you. I'm trying to explain.
It is because of stress only.
Not necessarily. Because chronic stress and genetic, I'm not covered all these medical topics because I believe that it's not supposed for today's discussion. See, all the psychiatric diseases are not only because of the stress, be it, again, keep it in your mind. Stress multiplied by genetic factors, which is called genetic vulnerability. If you have a genetic vulnerability in a family, I believe only doing this maneuvers is not going to help you properly. You have to have some professional help. So only reducing by cutting down the stressful events or this by applying this kind of like first aid mechanism. Suppose you have sudden cuts and injuries, you can go for first aid to the knowledge of all this. But you have actually fractured your tongue, you have to go to doctor. Only first aid will not do. So what I tried to discuss today about the first aid mechanism, how to prevent, how to somehow control. Now it is what if it is going beyond, as I told you, going beyond your control even after applying all this method that I have tried to percolate to you, try to impart to you, if not working anything, you have to consult. And which should be backed, which has to be multiplied by the genetic factor. So if you have family member, family history suggestive of certain psychiatric illness, you are prone to develop this illness in your life also. So everything should not be, again, this is might be a bit controversial right now. So any psychological disease should not be taken as a institutional fault or purely on stress normal. It's not true. Not true at all. But it all contributes. If you have a genetic vulnerability and you are having a chronic stress, you will have this serious psychiatric illness in your life. So all of these factors are equally important, if not more. So if you are having these issues regularly and no maneuver can help you, you have to come to a professional. Like a professional or something like that. Hope that answers your question.
Any more question?
Sir, I sometimes found while sleeping, some disturbing dreams are coming, and next day I feel that I have not slept.
This is actual psychiatric issue. That is why I am laughing, because I have already in the first slide I have told you, most probably have missed it. 40% of the engineers are suffering from some kind of psychiatric problem. So among the participants, I believe at least 40% of them have the issues. So no wonder. But again, if your having sleep is fragmented, as I already told you, fragmented sleep, early awakening, or difficult falling asleep, should be
Twice
considered.
in a month or
Now, if it is occurring very infrequently, you should not be bothered, you should not be worried about that. But if it is associated with some other issues, like as I already told you, emotional fatigue, irritability, lack of focus, feeling dejected, feeling very restless, feeling angry many times, cannot like forgetting things, like feeling gastrointestinal issues, like that. If you are having associated sleep disturbance with these issues, I think it should be treated properly and addressed properly. Not the first aid going to help. And this is a common question I find every talk, every seminar in this non-medical environment, whenever I try to this kind of awareness program, right? So this is a common question, because as we try to impart the knowledge and some ideas about how to prevent it, how to restrict it, but many a times the situation goes beyond our control. That times you have to, as I already told you, certain abrasions, lacerations will heal by its own, but a fracture will not. So you have to differentiate the intensity. The fracture requires an orthopedic surgeon. Only knowledge will not do it. The knowledge is the first step.
Any more question? Okay. So wonderful deliberation. So one thing we can conclude that everything is psychosomatic. That means our mind as well as our body is connected. So in a nutshell, Sir has told everything. How to check whether somebody, and one thing is very important: number don't lie. So 44% engineers are prone to psychiatric problem. So if your colleagues, if it is 100 faculty members in this seminar, so 44 people may have some psychiatric issues. Okay, now some of the coping issue. coping solution, has said some solutions on how to cope this thing, like some behavioral therapy, mindfulness, wonderful things. I used to practice this one. I think so many people are doing this thing in their life. Mindfulness even comes whenever you are listening something, be mindful on that. If you are taking a cup of tea, that time also just enjoy the tea only. Don't think some other things. If you are just taking notes, if you are just listening some song, so many times it happens that whenever you are listening something, you are thinking some other things. So that should be stopped. And thank you very much once again, Mr. Manish Roy. Now, after this session, we will have article summary discussion. So we will, we have already supplied, or we have already posted that, today's topic in the WhatsApp group, and it's a small tea break for everybody. Thank you.